We're talking this morning with Dr. Gerald Showalter, the director of our Brain Injury Services program here at Woodrow Wilson Rehabilitation Center. And Dr. Showalter, we understand that there's 3 brand new evaluation clinics available for clients with brain injury.
There are. We offer 3 clinic services, really beginning with a pre-referral consultative process where we would work with referral sources to gather information about a particular client's circumstances, and from that information discuss with the referral source or the rehabilitation counselor services the type of evaluation that might make the most sense given that client's circumstances. The 3 clinics really relate to a medical clinic, a BIS program feasibility clinic, and the third one would be a vocational clinic. These focus on really different client circumstances. The medical clinic is an effort to really try to give a comprehensive picture of client functioning across a broad range of that client's really areas of functioning. The intent here is to serve clients that may present with more significant impairment after a traumatic or other form of brain injury. The intent is to provide information that really would be useful for connecting that client to different forms of services and rehabilitation back in the home community. Our Brain Injury Services Feasibility Clinic really is designed to provide also a picture of a given client's current neurobehavioral and cognitive functioning, really for the purpose of helping to determine whether services back here at the Woodrow Wilson Rehabilitation Center might be helpful for that client and could help to advance that client's rehabilitation goals. This clinic is also 2 days in length for most clients and would involve a neuropsychological evaluation paired together with an evaluation by Dr. Matthew, our physical medicine physician. As well, we would have clients participate in some screening services with the different medical therapies, again, physical, occupational, and speech therapy. A core part of this clinic service is also focused on identification of work-related issues and the extent to which we might be able to work with clients to help them to move forward toward a vocational outcome. The third clinic that we offer is a vocational evaluation clinic, and this is a more abbreviated clinic process. For many clients, there would be the ability to complete this clinic in about a day and a half, 1.5 to 2 days. This would involve a neuropsychological evaluation together with more of an abbreviated vocational evaluation, similar to a mobile vocational evaluation, which would be approximately 1 day in length. This clinic really is focusing on clients whose maybe injury effects are milder in nature, and the client is perhaps at a point in recovery where he or she could move into vocational training services a little sooner.
And also with us this morning is Sue George. Sue has many years of experience as a field rehabilitation counselor with Virginia Department of Rehab Services in the Fishersville office, I believe. Is that right?
That's correct.
And what are you doing for us now, Sue?
I have recently transferred here to Woodrow Wilson Rehab Center to the Brain Injury Department, and I'm medical case manager for those clients that come back for residential services. Well, I believe from experience it's a team approach. You have a client with a brain injury or your rehab problem, and you have a team that is looking at that individual from both a cognitive standpoint, physical functioning standpoint, and then eventually a vocational standpoint, with that being the goal from the day they come in. So you have your experts that are working with this individual, this student, to help that field counselor or that referral source get them ready for the vocational plan and implement services that they need. So I think from an overall standpoint, it's the idea that you have a team approach. You're not in it alone. You have someone there for the guidance, for the information, for the expertise that you need in helping this individual return to employment.
If a referral source in the local community or field counselor has a client on his or her caseload that could benefit from services through the Brain Injury Services Department at the center here, to make that referral, the counselor would simply need to give us a call. And really the best direction to go with that call initially would be to contact either Heidi Balsley, who is our outpatient case manager here in the Brain Injury Services Department, or myself. We would try to do our best to work with field sponsors and referral sources to get those clients connected to services that could help to make a meaningful difference and maximize independence.